Hello everyone, welcome to my channel. Today we are discussing about gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. It affects how your body uses sugar or glucose. Glucose is important because it gives your baby energy to grow. Gestational diabetes usually starts around the 24th week of pregnancy. Most of the time it goes away after the baby is born. However, it can increase your risk of developing type 2 diabetes later in life. Gestational diabetes happens because of hormonal changes during pregnancy. These hormones can make it harder for your body to use insulin effectively. Insulin is a hormone that helps your body use glucose for energy. When your body doesn't have enough insulin or can't use it properly, glucose builds up in your blood. This is what causes gestational diabetes. Pregnancy is a time of significant hormonal changes, and these changes are essential for the growth and development of the baby. One of the key hormones involved is progesterone, which helps to maintain the pregnancy and prepare the body for labor. However, progesterone also has the effect of making the body less sensitive to insulin. This insulin resistance is a natural part of pregnancy and helps to ensure that the baby has a constant supply of glucose. In most women, the pancreas, which produces insulin, is able to compensate for this insulin resistance by producing more insulin. However, in some women, the pancreas is unable to keep up with the increased demand for insulin, and this leads to gestational diabetes. The exact reasons why some women develop gestational diabetes while others don't are not fully understood, but there are certain risk factors that can increase a woman's likelihood of developing the condition. Several factors can increase your risk of developing gestational diabetes. Being overweight or obese is a significant risk factor, as is having a family history of diabetes. If you've had gestational diabetes in a previous pregnancy, you're also more likely to develop it again. Other risk factors include having given birth to a large baby, over 9 pounds, in the past being over the age of 35, and having polycystic ovary syndrome, or PCOS. It's important to note that not everyone with these risk factors will develop gestational diabetes. Conversely, some women with no known risk factors can still develop the condition. That's why prenatal screening for gestational diabetes is crucial for all pregnant women. Early detection and management are essential for the health of both mother and baby. Gestational diabetes often doesn't have any noticeable symptoms. Many women who have it don't feel sick at all. This is why regular prenatal care and screening are so important. However, some women might experience increased thirst, frequent urination, extreme hunger, fatigue, blurry vision, or frequent yeast infections. If you experience any of these symptoms during your pregnancy, it's essential to talk to your doctor right away. Diagnosis: confirming gestational diabetes. Diagnosing gestational diabetes typically happens between 24 and 28 weeks of pregnancy. Your doctor will likely recommend a screening test called a glucose challenge test. This test involves drinking a sugary drink and having your blood sugar level checked an hour later. If your blood sugar level is high, you'll need a follow-up test called an oral glucose tolerance test, or OGTT. This test requires fasting overnight and then drinking a sugary drink. Your blood sugar level is checked several times over the next 3 hours. The results of this test will determine whether you have gestational diabetes. Impact of gestational diabetes on mother and baby. If left unmanaged, gestational diabetes can lead to complications for both mother and baby. For mothers, it can increase the risk of preeclampsia, a serious condition that causes high blood pressure and protein in the urine. It can also lead to a higher likelihood of needing a cesarean delivery. Additionally, women with gestational diabetes are at increased risk of developing type 2 diabetes later in life. For babies, gestational diabetes can increase the risk of macrosomia, which means being born significantly larger than average, and this can lead to birth injuries. Babies born to mothers with gestational diabetes may also have low blood sugar or hypoglycemia after birth, breathing problems, and an increased risk of developing obesity and type 2 diabetes later in life. Managing gestational diabetes, a comprehensive approach. Managing gestational diabetes usually involves a combination of lifestyle changes and, if necessary, medication. Your doctor will work with you to create a personalized plan that's right for you and your baby. This plan will likely include monitoring your blood sugar levels regularly, eating a healthy diet, getting regular physical activity, and possibly taking medication to help manage your blood sugar levels. Life after delivery: long-term implications and care. After your baby is born, your blood sugar levels will likely return to normal. However, having gestational diabetes means you're at increased risk of developing type 2 diabetes later on. Your doctor will recommend regular blood sugar checks after delivery to monitor your risk. Continuing with a healthy lifestyle, including a balanced diet and regular exercise, can help reduce your risk of developing type 2 diabetes. Embracing a healthy future: prevention and ongoing wellness. While not all cases of gestational diabetes are preventable, there are steps you can take to reduce your risk. Maintaining a healthy weight before pregnancy, eating a balanced diet, and getting regular exercise can all contribute to a healthier pregnancy. If you have any pre-existing health conditions like PCOS, managing them effectively can also help reduce your risk. Remember, knowledge is power. By understanding gestational diabetes and taking proactive steps towards a healthy pregnancy, you're giving yourself and your baby the best possible start. Thanks for watching my video. Please like and subscribe for more informative video. Stay healthy.